I've had a few questions around the similar issues. One is if the prostate cancer is close to the capsule, can that be treated? And that's actually one. And then the second one, there's a range of three or four questions talking about men who've got a level of blockage or difficult urinary symptoms, and they're wondering about the difference between a HOLEP and a cancer treatment. So they have a urinary symptom. They've also got a diagnosed cancer, and they're trying to decide what to do. And do they have a HOLEP first or a cancer treatment, or how should they handle that? And that's not an easy question, but that's what it is.
Yeah. So essentially, I think the patient asking that question must have some urinary symptoms, which is why it's been suggested that he needs a HOLEP procedure. HOLEP, by the way, for people who don't know, stands for Holmium Laser Enucleation of the prostate. HOLEP is not a cancer treatment. HOLEP is a treatment for benign prostate disease, whereby you can remove the center of the prostate through by using laser technology. There are many other ways to remove that central tissue. The standard is a TURP, TURP, which stands for transurethral resection of the prostate, but HOLEP can also be used for very large prostate sizes. So first thing to remember, HOLEP is not a treatment for cancer. Whether it is done before or after the focal therapy doesn't really matter too much. I actually often combine it at the same time. So the patient has their HIFU treatment or their nanoknife treatment or whatever the focal therapy is, and then at the end of the procedure, we carry out a disobstructive procedure to allow the patient to pass urine better. But they can be split if required, one following the other. And I tend to do the focal therapy first and then the disobstructive procedure, mainly because we're utilizing MRI ultrasound fusion to show us exactly where it is. Whereas if you've done the resection first or the HOLEP first, you then lose that definition and you'll need another MRI afterwards in order to assess exactly where the prostate cancer is. Your first question related to the capsule and so on. It's important to remember that the vast majority of prostate cancers start at the edge of the gland, which is where the capsule lies. So a lot of people might think, oh, it starts there and then it's growing slowly towards the capsule. No, the vast majority tend to start in what we call the peripheral zone, and so the vast majority of prostate cancers will be close to the capsule. Again, something that we evaluate very, very carefully on the MRI to check that it has not gone outside of the capsule, which would make it a locally advanced cancer. So as long as it's close to the capsule or abutting the capsule, then you can be treated with focal therapy.